Good afternoon. I hope everyone had a nice weekend and a good start to the week yesterday. I know there have been recent concerns about the COVID-19 cases in Missouri, so I want to make sure everyone is updated and accurately informed. As we have said this many times, the more testing we do, the more positive cases there will be. This is not a surge or a second wave going on in Missouri. These are outbreaks in specific areas, and we are aggressively testing in these areas to box in the virus and prevent further spreading. Even though we have seen some increases in certain areas, Missouri's positivity rate has dropped to roughly 5.6. We also have to remember that the vast majority of positive cases are not hospitalized. Our hospitals are still stable, more people are recovering, ICU beds and ventilators continue to become available. We are not overwhelmed. We are not currently experiencing a second wave, and we have no intentions of closing Missouri back down at this point in time. As always, we monitor these numbers on a daily basis, and we remain confident that Missouri is on the road to recovery. Today, I had the chance to attend a major job announcement in the St. Louis area. Accenture Federal Services announced its plan to open an advanced technology center in St. Louis County later this year, which is expected to bring in 1,400 new technology jobs to the St. Louis region over the next 5 years. This is great news for St. Louis community, our economy, and the entire state of Missouri, and we are proud and excited to welcome Accenture to our state. Missouri is already recognized as one of the most prepared states of the digital economy in the United States. And now, at this time, when many Missourians are looking to work, this move will create more job opportunities, grow our technology workforce, and strengthen our standing as technology leaders in the United States. This is another positive step for Missouri's economy. The jobs are out there, and they will bounce back. Again, I think it's important to remember in January and February, when we were at the highest demands in the state of Missouri, we were looking for employees. We had job expansions. We had business expansions. We had new businesses coming to our state. And yes, the COVID-19, when that occurred, shut that spigot off for a little while. But all those jobs, all those opportunities are still out there. And I think now, as we balance between the fighting a virus and open up our economy, we see those opportunities that are out there. And we're going to continue to be very aggressive on the workforce development and the infrastructure pieces of a state. Today, I also had the chance to meet with the president of Maryville University and other university leaders to discuss how the college is working to meet Missouri's workforce needs. Again, back to the initial, one of our priorities was the workforce that's going on in this state. Maryville University, I got a chance to meet with their administration or leadership. One of the things that they realized, change was inevitable to what's going on in our state, and it will change. It'll change how they do education. It'll change somewhat how our workforce comes back from this virus. And for them to have the opportunity to really meet the needs of the people out there that's going to be looking for those job needs and going to be able to retool and retrain was something very optimistic today that I got to hear their presentation up there. So I'm thankful they're focused. They're focused on creating jobs and getting people the training they need. And this afternoon I also went to the visit with the Post Commission to talk briefly to them a little bit about the future of their job and what it's going to entail too with some of the things that have occurred during the protest period of time, how we were going to view law enforcement, what we were going to do in the future to make adjustments, and what those adjustments will look like, that the Post Commission will take an active role in training as we move forward in the state of Missouri. As Missouri continues to recover, our budget is still being adjusted. To further assist with the economic impact of COVID-19, the offices of statewide officials, the Missouri House, and the Missouri Senate will be restricting a combined total of $2.4 million from their budgets. This includes the governor's office. With budget concerns and job layoffs and losses across the state due to COVID-19, workforce development and infrastructure will be critical to our recovery. This has always been a focus of my administration, and now more than ever, it is critical that we have skilled, prepared workers to fill jobs and meet the needs of our economy. The Missouri Department of Higher Education and Workforce Development is working hard to support our workforce and help them return strong. Today, Commissioner Mulligan is here to give us an update. So, Commissioner.
Hi there. Good afternoon. It's a pleasure to be here with you today. I'm Sora Mulligan. I lead the Missouri Department of Higher Education and Workforce Development. And as the governor mentioned, we're absolutely thrilled to be in a position to help some of the many Missourians who are still looking for work. We're seeing lots of signs that Missouri's economy is coming back strong, and we're delighted by announcements like the one the governor made in St. Louis today. That's fantastic news for the community as well as for the state of Missouri. But we're also mindful that there are still a lot of people who've been laid off and who are now trying to figure out what they're going to do next if they work for one of the companies that's indicated they might not be able to rehire everyone who was laid off. We know that losing a job can create a sense of real despair, and we like to say that at the Department of Higher Education and Workforce Development, we're in the business of hope. Hope is the opposite of despair, and opportunity is really, really critical to that building of hope and the opportunity to grow. So I'm excited to talk with you today about a couple of things we're doing to increase opportunities for Missourians. As the governor mentioned, last month the Missouri Department of Higher Education and Workforce Development launched the Return Strong program, which is aimed at strengthening Missouri's workforce as it bounces back from the economic impacts of COVID-19. Return Strong is really about two things. It's about helping people search for jobs, and it's about helping people access training when they're out of the job market. And we've made a lot of progress toward those goals. So Return Strong is largely about getting training dollars out to local communities. Local workforce development boards and job centers now have access to funds they can use to help people connect with short-term online training programs so that during the time people are sitting out of the economy on unemployment, they can be building skills that will help them return to work not only sooner but also stronger. So that is a fantastic success, and we're really proud of it. Right now, we've got more than 1,000 new participants in these job training programs, and we're looking forward to having more enter as we identify additional funds and more programs in the future. This is an illustration of the extent to which education changes lives, and we're, again, delighted for the local partnerships that have made this possible. We also have outlined a plan to help Missouri's job centers reopen safely. For those who aren't familiar with Missouri job centers, they're partnerships between the state and local government. They're places where people can go to get help finding a new job and where people who are unemployed can get assistance either with training or job search. So we put safety as a priority and reopening as an additional priority because we know that people are going to need these increasingly in the future. Just a little bit more detail about the training component of this, because I know that many of those reading your publications, watching television, or listening to the radio will have questions about exactly what it means. Right now, we have vouchers of up to $4,000 that people can access if they meet qualification requirements, many of which are related to being unemployed. $4,000 goes a long way toward a short-term credential that, again, can help you return to the economy safer and in a better position than in the future. One of the final things I'd like to touch on is that we're doing virtual job fairs. So like our colleagues around state government and throughout the state, we've really had to rethink the way we do our business. So if you think about the job fair of 3 months ago, it involved thousands of people in a room, usually interacting face to face. Job fairs are still very, very important ways for people to learn about employment opportunities, but that old face-to-face work isn't going to get done, at least in the near future. And so we've shifted to having virtual fairs that are a great resource. You can learn more about all of these at jobs.mo.gov or at the governor's Show Me Strong Recovery website. And I'll be happy to take questions after everyone gives their remarks. Thank you.
Zora, thank you very much, and keep up the good work when it comes to this training on this workforce development. Like all of the state departments, the Missouri Department of Revenue also continues to support Missourians and find new ways to meet their needs throughout the recovery process. Director Zellers is here to give us an update from the Department of Revenue. Director?
Thank you, Governor. Good afternoon. I'm Ken Zellers, Director of the Missouri Department of Revenue. Thank you to Governor Parson for this opportunity to provide an update on the Department's ongoing recovery process. 3 months ago, the Department of Revenue announced changes related to tax, motor vehicle, and driver's licensing in response to COVID-19. We took steps to help alleviate congestion in contract license offices. As part of those efforts, we granted an automatic 60-day extension for Missouri driver's licenses, non-driver licenses, and instruction permits with original expiration dates of March 1st of 2020 through April 30th of 2020. We also granted an automatic 2-month extension to vehicle owners with license plates expiring in March and April. At the peak, approximately 140 of the 173 contract license offices in Missouri closed due to COVID-19. So although these extensions were necessary and tremendously helpful for thousands of Missourians, they have resulted in a recent influx of customers to license offices throughout the state. Additionally, since reopening, license offices have had to implement extra safeguards, such as daily deep cleaning and social distancing, to reduce the risk of COVID-19. The increased transaction volumes at license offices, combined with the ongoing necessary safety measures, have led to longer lines and increased transaction times. Know that we are working closely with license offices to help them increase efficiencies during this unprecedented time. The Department has also instituted numerous changes to our normal transaction processing and increased our focus on online and mail-in renewal transactions to assist as many Missourians as possible. Here are just some of the additional steps we've taken. We have refocused efforts to efficiently process the 300% increase in online motor vehicle registration renewals, as well as the 28% increase in mailed motor vehicle titling and registration applications. We have also made changes to allow license offices to process many motor vehicle renewal transactions by phone. In concert with the Department of Homeland Security, we waived certain CDL requirements, and we continue to offer mail-in driver's license renewal services to CDL holders to ensure that drivers are able to transport necessary goods throughout Missouri and across the country. We contacted all remaining counties that do not currently provide personal property tax data so that their residents can use our online registration renewal portal. Thanks to these efforts, one additional county has since come on board, and we're working with 2 other counties to get them on board in the coming months. In May, we implemented a virtual lobby in our state-managed central office in Jefferson City so that our customers at that location can receive a text message when it's their turn to be served. Just last week, we announced that starting July 31st, we will automatically renew and mail permanent disabled placards for over 200,000 eligible Missourians who now won't need to visit a license office to renew their expiring placards. This will also reduce some of the overall foot traffic at license offices throughout the state. Finally, we are taking steps to open a few temporary license offices in the state, and we are beginning to implement a phone-in motor vehicle renewal service in Jefferson City, which will enable our customers to call in to renew their license plates. To their credit, despite all the changes to operations, Missouri's independently owned and operated license offices are, on average, assisting more customers each day than they did at the same time in previous years. On their own initiative, some offices have implemented virtual lobbies or appointment systems to better assist our customers. Some have hired pre-screeners or greeters to ensure customers have what they need to complete their transactions. Others have installed plexiglass, initiated deep cleaning guidelines, and provided PPE for their employees. Since Missouri entered Phase 2 of the Show Me Strong Recovery Plan 1 a week ago, the Department has refocused efforts on next steps to ensure the license offices are meeting their contractual obligations. However, it is important to remember that some offices may continue to be under local orders that restrict the number of individuals allowed in an office at one time. and social distancing and other safety precautions remain highly encouraged. On the tax front, we provided automatic special tax relief to individuals and corporations by extending several federal and payment deadlines, including those associated with individual and corporate income tax, to July 15th of 2020. That extended deadline is now just over 3 weeks away. Penalties and interest will begin to accrue on any remaining unpaid balances as of July 16th. Individuals and corporations that file their return or request an extension of time to file by July 15th will automatically avoid interest and penalties on the tax paid by July 15th. As of June 17th, all 6 of our tax assistance office locations have been reopened to walk-in customers after temporarily closing. Additionally, social distancing practices and our virtual lobby text messaging system have been implemented at all of these offices. We have received and processed over 2.6 million individual income tax returns, and this is about 244,000 less than the same time last year. But again, we know this is largely due to the filing extension. We're also working quickly to process returns and issue refunds. We continue expanding the knowledge base of our 24/7 virtual assistant chatbot, Dora, which has now provided more than 850,000 responses to customer questions. A variety of other online resources and services are available on our website at dor.mo.gov. Before I wrap up, I want to mention that yesterday the department began issuing the new Missouri driver's license statewide. Along with an updated design that celebrates Missouri's upcoming bicentennial, the new driver's license includes enhanced security features that will further deter counterfeiting and fraud and help protect Missourians from identity theft. There are no additional fees or costs to obtain the new driver's licenses as part of the normal processing. However, anyone requesting a new driver's license or ID card outside of their normal renewal period and solely for the purpose of obtaining the newer version will have to pay the standard duplicate processing fees. Missouri residents will continue to have the option of applying for a Real ID compliant driver's license or ID card. As I've stated before, from the beginning, the Department of Revenue has adjusted our policies and procedures to help protect the health and safety of our customers, license offices, license office staff, and our team. We strive to provide exceptional service, and we look forward to serving the people and businesses of Missouri. Thank you.
Thank you, Ken. Appreciate the good work you're doing. When you mentioned the bicentennial, it made me think that's coming up shortly, too. In 2021, we got a lot of celebrations to do, so hopefully we get everything back on track by that time so we can all celebrate 200 years of Missouri on that. Dr. Williams is also here today to be able to take some questions after we finish up here. And so let me just finish up here real quick and we'll get to the question portion of this. So again, I want to remind everyone that we are on the road to recovery, but please continue to be aware of the virus. Social distancing is still critically important to protect ourselves and others. If you can't social distance, wear a mask or face covering and take additional precautions. Be proactive, wash your hands, and use common sense. Like I said last week, we have to move forward and get the economy back and running while still protecting public health. And we can do both, and together, Missouri will succeed. Thank you, and God bless. Kelly, let's open up for questions. If they ask tough questions, I'm going to have AJ answer them today. All right, let's go.
Thank you, Governor. Commissioner Mulligan? I think you're off the hook. All right, thank you. Director Zellers? Jack?
So given that different private license offices have different practices now as we're reopening, does that make Missouri less efficient or more efficient when it comes to processing driver's licenses and tags?
Well, I'd like to believe that it makes us more efficient. We have a pretty efficient system here in Missouri, and we on a daily basis are comparing notes with surrounding states. And I believe that based on the data that they've shared with us, we are in a much better situation than the surrounding states. And all those, even though that they're individual businessmen and women, they all abide by the same contract, and it's very well thought out. It's very methodical. And the guidelines are such that it's beneficial to the offices and to our office and to the citizens of Missouri. So to answer your original question, I believe that based on the data, we're in very good shape.
All right, thank you, Director. Dr. Williams? Philip?
Hi, Dr. Williams.
Hey, Philip.
Given that we're relying on individual people at this point to choose to social distance, to choose to wear masks, are you satisfied with the reach of the information campaigns that are out there so far, and have you thought about expanding those campaigns at all?
I think it's a good idea, Philip. The governor has been incredibly purposeful, I think, at every one of these, at pushing that message out, and really appreciate his emphasis that, 6 weeks into our transition and including completely opening up 1 or 2 weeks ago, we can't forget what got us here. And what got us here was the citizens of Missouri doing exactly what you just heard him say: social distancing, wearing a mask if situational awareness would have you do that, and using good hand washing. So we greatly appreciate y'all helping put out that message, and I think anything that we can do to be more intentional about that's a great idea. Thank you.
Thank you.
We're seeing an uptick in cases going up, but the number of hospitalizations is staying steady.
Right.
What conclusion do you draw from that, and what is the delay between somebody getting sick and then having to go to the hospital?
Gladys, thank you. I'll answer kind of in two parts. The first thing is that usually when you see new cases coming up, you're usually seeing about a 2-week lag in that by the time they get incubated and tested. And then usually the length from that to the time that they get sick enough to be hospitalized would be about another week. So to your point, one thing that we watch very carefully is our hospitalizations, which are really at an all-time low here in Missouri, but that's really an indicator of what was happening probably about 2 to 3 weeks before. I want to speak a little bit, if I could, to broaden your question. We just put out a press release about 2:30, and I'm sorry I didn't get that to you a little quicker. We have seen an increase in cases, but as we look at that, as you know, we get up every day, as we've talked about, and so in follow-up to conversations we had last Tuesday and Thursday and today, as we look across the state of Missouri right now, and we look at our positivity rate, and as the governor said, overall it's low. Most recently it's even lower. That's a critical number, and ours is very low. When you look at our hospitalizations, when you look at our ICU and our ventilatory capacity, and when you look at the infectivity rate for the state, we are very appreciative of where we are here in Missouri. In fact, people are calling me, asking me kind of what we're doing here. But as we opened up the state, we knew, and the governor was insistent that we be ready for outbreaks. And what you're seeing right now in southwest Missouri that we worked on all weekend is a classic example of that in 4 counties, and it even affects even more than that, mostly around food processing plants, but also in the community in large. 3/4 of our cases over the weekend came from those counties for the whole state of 114 counties. We used to see that with St. Louis County and St. Louis City. 50% of our cases were coming there. That's dropped off. This was 75% were from the McDonald, Berry, Newton, and Jasper counties. So what are we doing about that? What we're doing about that is we're doing a lot of testing. The plants are testing all their employees. They're doing robust cleaning. We're engaged in contact tracing. We have sent this weekend contact tracers down to that area. The CDC is coming in this week to do an epidemiological investigation like they've been doing in northwest Arkansas to see if they can figure out the mode of transmission. Is it community? Is it work? Just that. So they're coming in to do that. For those patients who have been hospitalized, to the original question, I got called, I think, on Friday or maybe Saturday about more remdesivir in Joplin, and we sent them that for a slight increase in patients they were seeing from that. And so we're very much boxing that in and very appreciative of our local health departments, very appreciative of our department that's sending help to them, very appreciative of the plants that are testing everybody, which is what we would hope that they would do. Now, I remind you that the vast majority of those people that are testing are asymptomatic. So that 400 number is very different than a 400 number in April, in which we were just checking symptomatic people throughout communities and nursing homes. These are asymptomatic people that we're just finding out they're positive. So as you look at the numbers, we've always said we're going to treat the patient, not the chart. Just remember those numbers to us as clinicians and epidemiologists represent a different clinical indication.
What would you have to say to Missourians who, are just seeing these numbers and are worried?
Yeah. What I'd ask them to do is to try to understand the story behind the numbers. That when you see a statewide number, but realize that 75% of those numbers are coming from 4 counties in a state of 69,000 square miles and 6.1 million people, that you've got to have that kind of critical thinking to understand that that's an outbreak. It's not a surge. It's not even, it is an outbreak, and we're very much boxing it in so it doesn't spread.
I have one more question. So President Trump at his campaign rally suggested conducting less testing to see less higher numbers in cases.
Yeah.
What do you have to say about that, and is that something that you are considering?
You probably saw Tony Fauci testify today before the House and said that actually we're trying to do more testing, and the governor's been incredibly purposeful about that so that we have that capacity to do what we're doing now in Southwest Missouri. And thanks to his efforts and many people on the team, we're able to do that now. We're able to get in there very quickly over the weekend and do that kind of testing. So my answer would be, and I've seen different responses out of the White House to that, but I agree with Tony Fauci that we want to do more testing. We think that helps us very much.
You mentioned remdesivir a minute ago. What's the supply of that like at this point?
Yeah, I think we got our 4th allotment. I think that's right. Last week, we keep 25% in reserve just so for situations that happened in Joplin on Friday or Saturday that they could call me, that we can get it out to them. So right now, I can't remember exactly how many vials we have, but I get all the requests. They come to me, and right now I think we have an ample supply.
And if we need more, is it not a problem to get more?
We get an allotment once a week from the federal government, and they send us what they're going to send us. So at this point, though, based on our hospitalizations being at an all-time low, especially in the St. Louis region, the feedback I get, the governor and I were on a phone call Saturday morning. We are every Saturday morning. And the feedback we got was very positive, that people are, first of all, very appreciative that we've pushed it out so quickly and that they have it pre-positioned so they can use it immediately. And I did not sense, other than Joplin, that there was a need for more.
Hi, Dr. Rowland.
Hey, Connor.
So just kind of about demographics, thinking about where we were and where we are now, how many of these new cases are younger people that we're seeing
Yeah, it's a great question. I don't know if you know, but nationally, you're seeing a lowering of the average age, and we're seeing that in Missouri as well. The average age for was about 55, I think, 54, and it's trended down to about 51 or 50, if I remember correctly. But to your point, a national story right now is as people reopen, there tends to be a tendency for younger people to be making up a lot of the new cases. And that's, to Philip's earlier point, is that we need to do a really good job of messaging to younger people probably that, as the governor always says, the virus is still here. And we need to work very hard with our social distancing and face mask if needed, and our hand washing to that population as well.
And do you have any idea, preliminary, like why it might be trending downward to younger ages?
I think they're more apt to get out. They're more apt to congregate. I think that other people, very thankfully, are practicing situational awareness and going, well, if I'm 70 years old with comorbidities, maybe this isn't exactly a time to re-engage in gatherings. But I think your typical 25, 30-year-old has kind of been quicker to do that. That's what I think is going on.
Thank you, Dr. Williams.
Thank you.
Governor Parson? Jack?
Yes, hi. So, given the president's comments over the weekend when he suggested slowing testing down, and given that increased testing has been such a pillar of your reopening plan, what was your reaction to those comments?
I don't know what the president said over the weekend. I'll just tell you that. I don't know what he said, but for us, we're stay focused on testing. We believe that's important. And I think it goes back to what Dr. Williams just said when we talk about some of the younger people that's testing positive. I think a lot of that's due to testing. Before we were testing people that were sick early on that had the symptoms, and now we're testing a lot more people. So I think it's it. But it's important. It's important to me to test, and we have no plans here in the state of slowing down testing.
He said, sorry to cut you off. He said that he said to his aides to quote slow the testing down, please.
I haven't heard him say that, so I don't know what I think that was is that a media report, or is that what
No.
is that what he quoted saying?
He said it at his campaign rally.
No, I don't know anything what he said at the campaign. I didn't watch his campaign rally.
All right, Phil?
Hi, Governor. Have you made a decision yet on gear funding? And if not, would you make that before you make a decision on the budget?
On which funding?
This is educational funding for higher ed and K-12. It's the $50 million or so, $54 million.
Yeah, well, look, are you talking about 21 in the budget as far as withholds? Or are you talking about?
This is through the CARES Act.
I'm not sure I'm getting the question. Sure.
It's about $54.6 million, and gear funding is the acronym. Have you made a decision how you plan to use it yet?
I don't think, maybe my staff maybe has, so I'm going to be careful how I answer. They're working on that different CARES Act funding all the time, and some of it's come in. We know there's a pool of money that's going into the education systems on K through 12. We know some through higher education, but I'm not for sure. But my staff probably would be able to do that. You can check with Kelly, and we'll try to get you an answer on how that is. I'm not aware how they're spending that just yet.
Hi, Governor. So we've been seeing some larger increases in numbers, and of course, you're pointing to increasing in testing for that. At what point, and you said there's no plan right now to close anything right now. At what point, and I know this has kind of been asked before, would you maybe consider if there is any community spread? At what kind of point would you?
Yeah, you know what? We're not looking at shutting the state down again. We're just not looking at it from that angle at all. To be right honest about it, we feel like this is a virus that's out here, and this virus is not going to go away. So every time we meet, for however long we're meeting out here, the rest of the summer into the fall, that virus is still going to be there until there's a cure for the virus. So that's not going to change. So the economy has to reopen. People have to get back to some sort of normal life. Schools have to get back engaged. Again, I'm going to go back to what I've been saying all along. Social distancing, to me, is the most important thing you can do. All options, if it's a mask, if it's not going to an event, that's up to every individual to do that. But we're not going backwards here. We're moving forward. The economy is going to open up. We're going to fight this virus as much as we possibly can every day to make it better. And I think I'm confident with Dr. Williams, with the support of the health care centers across this state, with the National Guard, we got the resources available in this state to fight this virus, and we're going to continue to do that.
We've seen some of the highest increases in cases in our neighboring states like Oklahoma. Can you draw any conclusion from neighboring states having these high increases to what may happen
not
here?
really, and simply because I don't get into their numbers and their details that much. I know Texas has kind of had a spike with that younger generation from 20 to 30. I know Arkansas has been pretty overwhelmed in a lot of different areas. I'm not sure about Oklahoma, where they're at. All I know is what we know from the Missouri data that I'm looking at every day. And I'm going to go back. That was critical in the decision process for us every day. We know those areas I talked to you are high risk. We know, like a food processing plant. We know nursing homes, the African-American community, the prisons. We all know now that we need to target those areas, or to be very watchful of that to make sure that that's where it could be. And I think right now that's kind of running true to course. Not to say there's not some other business that could have an outbreak, because it could. But I think we're well prepared to take care of that.
Okay, thank you.
Yep.
In the past week, Missouri has seen an increase in the R0 value, which predicts the number of people someone infected with COVID-19 will go on to infect. What role do you think the state reopening has played in that increase?
What do I think the reopening the state will display?
Yeah, so in the past week, our number has gone from below 1. So with the R naught value, below 1 means that it's less likely for someone with COVID-19 to infect another person. And now we're at around 1.25. That's a pretty dramatic increase in that number. And that's come as we've seen the state reopen and seen more people get out and about. What role do you think reopening has played in that increase?
Yeah, well, I think anytime you reopen, more people are going to come together. It's summertime and everything. But now I don't agree with you. The number between 0.09 and 1.1 is a drastic increase at all. I don't think that's the case at all when you're talking about the thousands, how that's compared to. I think more people are getting out, more people are going to come in contact with one another, and that's just going to happen. I mean, it's just going to happen. Again, this virus, for the majority of Missourians, are going to go home. They're not going to the hospital. They're not going to sit in the doctor's office very long. Once they have it, if they're asymptomatic, they're just going to have to sit at home for 14 days. The large majority of that. Somebody's asked me a while ago about Arkansas. I think one of the things I wish we would have done was kept our recovery rate, and I wish we'd be talking about that a lot more. But I think Arkansas had 14,000, 15,000, some of you might know, but their recovery rate was over 10,000. Which means the vast majority of the people is done with it. And I think you'd say the same thing for Missouri if you look at other states. I'm going to say out of the 18, 19,000, whatever we've got on there, the vast majority of those people are recovered. It's not even a realistic number, but we always use those high numbers to spread that a little bit. But I think we're fine. I think where we're headed in Missouri, I don't think anything's happened that we wasn't expecting to happen at this point.
Do you feel any personal responsibility for the people who have infected and don't recover after you chose to reopen the state?
Let me just say this. I don't even know where you come up with that question of personal responsibility as governor of the state of Missouri and when you're talking about a virus. That's no different than the flu virus, or do I feel guilty because we have car accidents and people die every day? No, I don't feel guilty about that. Each person that gets in those situations, things happen like that in life. They do. I don't know that any one person's responsible for that, no more than anybody else standing out here in this hallway. I could say the same thing for the media. Maybe you don't do a good enough job really telling people the facts. Do you feel responsible for that?
Well, I think the media's job is
No,
to
I ask you a
spread
question. Do you
information.
feel responsible about it?
I personally don't have the ability to reopen states and say that businesses
No, I
can
didn't
return
ask
to
you that. I
normal.
said, do you feel responsible to the people that you address when you write your stories and you write your articles? Do you feel responsible if you say things that people don't agree with or that things might harm somebody?
I feel responsible if I report inaccuracies, but that's not what we're talking about here.
Okay, well.
One final question. Does anybody have one final question? All right, thank you.
All right, thank you very much. Thanks, everybody.